Hello, Martina. How are you?
Hi, Lourdes. I'm okay. How are you?
Good, thank you. Can you please introduce yourself and tell us about your area of research?
Sure. So, yes, my name is Martina and I'm from Italy. I moved into the UK in 2013, so I've been living here for a long time. And I'm a clinician with a strong interest in research, and my area of interest is cardiovascular disease and inflammation. My PhD, I'm working on a project on platelets and immune cell interaction in the context of cardiovascular disease and aging. The PhD is funded by the Wellcome Trust, so I'm part of this 4-year PhD program called MIDAS, Mechanism of Immunity and Inflammation.
Why is that research important?
So sepsis is a serious condition causing around 37,000 deaths per year in the UK, so affecting the NHS enormously. In patients with cardiovascular disease or elderly patients, sepsis tend to have a really worse prognosis. That's because their immune system is not really able to respond properly. So we are trying to find out whether targeting specific platelet receptors can actually modulate the immune response and improve sepsis outcome.
And what progress have you made so far?
That's a good question. So my PhD just started 6 months ago, so it's been really just everything very new, and it's been a really steep learning curve for me to learn new techniques because of my clinical background. But so far we've been able to show that platelets from young and old individuals have a different capacity and ability to form clots, and also platelets from atherosclerotic mice are hyperactive with respect to normal mice. So this is quite new and challenging and promising, and probably, of course, we need to do a lot, but something is there, I believe.
That's very interesting. And tell us, what do you enjoy about the research?
Well, I think if I had to summarize in 3 words what led me to move from clinical to research, is probably curiosity, creativity, and dedication. So I really enjoy research because it gives you the opportunity to make hypotheses, in my case from the clinical practice, and then try to actually go through this journey of designing an experiment, making the experiment, and then going to the results. And sometimes the need of changing your path and try to understand what's going on, to the frustration sometimes. And research gives you these special skills, so the dedication, the resilience, be patient, be focused, be consistent and precise, and be honest and humble. And also, I've already seen in these 6 months how important is the teamwork, which I think is unique, especially for research.
Well, finally, what is your longer term ambition?
It's another good question. So I cannot deny I really miss my clinical practice because this is a full-time PhD program, but I have to say that I really see these 4 years as my unique and huge opportunity to develop my research skills. So my long-term ambition is to become an independent clinical scientist, so a specialized doctor with some research and teaching responsibilities. And obviously, this PhD will probably give me, or hopefully will give me, the skills that I need, or a basic understanding of research, and being able to actually carry on my own research projects later on. And obviously I found already a huge support from the University of Birmingham, from the Wellcome Trust, and from the platelet group where I am at the moment. And I'm very happy.
Good to hear that. Thank you so much, Martina, and good luck.
Thank you, Lourdes.